Hello, All-Star listeners, and welcome to another episode of the Veterinary Roundtable presented by All-Star Veterinary Clinic, the podcast where we answer your veterinary-related questions while having some fun along the way. We've gained hundreds of new listeners these past few episodes, so if you're a new listener, welcome. If you enjoyed today's episode, be sure to leave us a review on your podcast provider of choice because we finally have some reviews. Woo woo!
Ooh,
I know.
More than one? Last time I thought we
was
only
it
had
just one Harrison Branch, or is it more than one? We have two. We have two.
We have two reviews.
So, yes, keep leaving on Apple Podcasts.
Okay. Oh,
Spotify, we have 34.
Oh,
that's exciting. Okay, keep leaving those reviews.
We don't know what the reviews say though, so
Harrison does. He keeps us in the loop.
Okay.
So if you have any feedback to offer to improve the Veterinary Roundtable, let us know. Speaking of reviews, I'd like to read a review we received from one of our lovely listeners. Here it goes. I love learning about the lives of veterinarians. This podcast is so fun and informational. Hello from California.
ooh,
At Shepster1692.
sunny California. Jealous.
I know, especially this time of year in Indiana.
Well, we had a mild winter. It's getting there.
I really am on to now that we're at the end of February, it's really just March.
Yeah.
And then once we're in March, then it's really just April.
Don't
you like how that works?
Really
You just keep going. It's we're already in February, so it's basically like March.
Oh, I see what you're saying.
See, you just get further down the line.
Yeah. And then we're back to winter again.
And then we're back to winter. March is just so freaking long of a month. It's like a long month.
It's because February's short.
Right.
Yeah, I feel like February's short, but it feels long. It's the worst usually.
I agree with the weather. It is not good.
Yeah, at least it's supposed to be 60 something on Thursday.
I know. I'm very excited.
We should close down the clinic and celebrate the warm weather.
We don't close down when it's a blizzard, but we
will close down when it's
to celebrate spring.
Oh gosh.
I just saw, this is so random, but I just saw on social media that Spain is the first European country to now allow menstrual time off for females.
Oh dear God.
I'm like,
our clinic would be shut down.
They are just taking care of those women over there.
Oh my gosh. Yeah. I mean, that wouldn't even work here.
Oh no, yeah, we would be screwed.
Harrison, you're by yourself.
Already with maternity leaves. We're like,
I know,
you get a maternity leave. Harrison and Caleb.
Yep, running the clinic, running the show.
Caleb and Harrison.
Oh, okay. So on today's episode, we have a full panel of veterinarians. I'm your co-host, the one that usually keeps the show rolling, Dr. Ashlyn Duckwall. Sitting next to me is All-Stars
No,
youngest.
Sitting next to me.
No, sit next to King. Typo. Is All Stars youngest veterinarian and new puppy mom, Dr. Lauren Schmoke.
She's not here right now. She's here. She'll be joining us in a second.
Really?
She's doing surgery.
Yeah, we're on top of it today. Yeah. The freakishly smart one, Dr. Ashley Dudley, and the head veterinarian of All Star, mother of 5 boys, and the reason we're all here, Dr. Emily King. How you guys doing?
Doing well.
Yep. I'm doing well too.
Great.
You two pregnant people, you feel good?
Sure.
I was walking
as well as you can.
As well as a pregnant person can feel.
As well as your new normal.
As well as a new normal. I was just walking in the hallway and I had to stop because she kicked me so hard. And Courtney was like, "Are you okay?" I was like, "Yeah." She just really aggressively moved.
Yep. They'll catch
time
you off
out
guard.
now.
I know. They'll catch you off guard.
Yeah.
I told Doug while she was trying to run one Friday ago or whatever, and I was like, "You need to hold your abdomen."
Tried to run.
Yeah, I was like, "That's not going to work."
And they were like,
I thought you went for a jog
No.
outside. I was like,
"Hold your abdomen really tight and run down the hallway."
Yeah, because I started and I was like, "No,
that's not going to work."
Fast walk.
With my last one though, I did end up doing CPR 8 months pregnant. So. Things are doable. You have to use your ab muscles. You have none.
Adrenaline kicks in. Adrenaline kicks in.
Yep.
They're all feel later.
Yeah. Yep.
Fun stuff. Miracle of life.
That's right.
Icebreakers. You want
Okay.
to do the first one?
Is it pronounced pecan or pecan?
Pecan,
right,
without a doubt.
Pecan or
Pecan.
pecan?
Pecan pie?
It's
I like
pecan.
Pecan pie?
I don't know. If you're in the South, it's probably pecan pie.
I think
trying
I
to
flip
think.
back and forth. I think I'm influenced by everyone else.
I think so too, actually. Now when you just said pecan pie.
You're like, this
or
doesn't
pecan.
sound that
No,
weird.
I say pecan. I say
Pecan pie.
pecan.
Pecan. Welcome to the discussion, Schmokies.
We're really in depth right now.
We're talking about pecan or pecan.
What's your dialect? Oh, we have to move your mic down.
Pecan.
Pecan. I'd like a piece of pecan pie. Let's just keep saying it because it's going to get weirder and weirder. Pecan. Pecan.
Pecan sounds too exaggerated.
Done one of those dialect quizzes so it tells you what portion of the country you're actually supposed to be
from?
So yeah, it'll like ask you these questions and you have to select which ones or like what terms you use. So like, is it a sofa? Is it a couch? Is it a Davenport?
Like soda or pop?
Soda or pop. Things like that. It asks you all those. And so it'll tell you what region you're from.
Oh, that's fascinating.
Or it thinks you're from.
Yeah.
Okay. We might have to do that.
So I guess I'd be curious, listeners, California person, do you say pecan or pecan?
See, when you said it right there, that sounded pretty good.
Pecan?
Yeah.
Pecan. It's pecan.
My dad's from California. I'm pretty sure he says pecan, but I don't know if that holds true all the way through.
Yeah. Interesting.
I feel like it takes too long to say pecan.
I know. Pecan. You just say it
so you gotta say it like that.
Say it like
you
that.
gotta say
that makes it
pecan
like
pie. And now we're all gonna want some pecan pie.
Yeah, it does sound nice.
It's really good.
Number 2. If you were a product in a pantry, what would you be? This is a
side note. This is an interview question here.
It is.
It is?
Yeah.
That's awesome.
It is in the peer interview.
Yeah.
Yeah.
It would be.
Obviously not for doctors, apparently, but yes, our staff have been asked that question as they're.
It gives you a good perspective of.
Yeah.
Okay, so what would you say?
So mine, I switch, and I can have different explanations for different things. I'd probably say flour.
Okay.
If you're choosing a pantry item, because it can be savory, it can be sweet, it can be used as versatile as needed.
Yeah.
So that's what I pick.
I didn't think that hard about mine. I said salsa just because I like it.
Spicy.
That's what I was going to say. I was going to say like
medium or hot.
I could go between mild and medium. Depends on the mood, but I could eat it every day.
I could drink it.
So
like
good.
really good salsa.
Like homemade.
Like Michaela makes salsa, homemade salsa. And you could it's like just enough sweet, like it's hot and you could just drink it.
Yeah.
It's so good.
I'm gonna have to go hit her up for that.
Yeah, you got to go ask her for it. It's really good.
Well, I was thinking the box of instant mashed potatoes in the corner, you forget that's there. And then when you really need something, it comes and saves the day.
Oh, I like it. Yeah. That's really good thinking.
So then you're like you're surviving out of all the things for a while.
You do not perish.
Yeah, you do not perish. And then you save the day when you're hungry, just instant mashed potatoes.
There you go. Come out of the blue.
So I thought
hiding in the background, and you just come through there and save the day.
Put a smile on someone's face.
That's right. I like that. That's good.
What about you?
I was gonna say, I was going with schmoke, and now I'm having a brain fart. The red sauce that's spicy, sriracha.
Oh, yeah, you can put on anything.
Because I'm spicy. I don't know.
We just got a whole new bottle of that.
Yeah, it's really good for making wing sauce. Mm-hmm. That with some teriyaki and some honey, and you put it together with a little bit of sesame oil.
Oh,
and it makes a great wing sauce.
Yeah, that sounds amazing.
Yeah, it's really, really good.
We've talked about the sriracha ketchup, right? We have sriracha ketchup.
I have not tried that.
Okay, I need to bring some because it's really good. It's like the right mix of the sweet with the ketchup and the spicy sriracha.
Yeah, I can't eat sriracha by itself. It's too hot.
Just mix it with some ketchup.
Yeah, you got to mix it. Okay. So we need to mention Audible, which this is the part of the podcast that I dislike the most because I'm not into advertisements. But so the Veterinary Roundtable has an exciting offer for our listeners. Use the link www.audibletrial.com/vet roundtable to try Audible Plus Premium for a 30-day free trial. By using our link, you'll also receive 1 credit or 2 credits if you're an Amazon Prime member and access to thousands of titles through the Audible Plus catalog. What else does Audible offer, Duckwall?
You know what I realized? The last 2 times I've done this, I say /. So hopefully people aren't typing it in.
Is it /? No, it's /.
No, I think you're right.
Okay.
But when you said that, I looked down at what I'm supposed to say, and I was like, oh, crap. Hopefully people are typing it in right.
/ Yes.
Okay. Anyways, podcasts, guided wellness programs, theatrical performances, comedies, originals, and more. One of my favorite books, and Dr. King's, Who Moved My Cheese, is available on Audible and discusses dealing with change in a way that brings more success than stress. That's www.audibletrial.com/Vet Roundtable for a 30-day free trial on to Audible Plus Premium and more.
There we have it. That's a lot.
Can we just get a recording of us saying that and then just play it every time?
That's what we need to do.
Let's do it.
We'll just hit play.
Okay,
so on to case collections. Who wants to go first?
Listeners love this. Smokey, go first.
Have we talked about a rectal prolapse yet on here?
Nope.
Okay.
I don't think so.
This, I know, it's kind of a weird topic, but this case, Dr. Pulse and I both saw, so we kind of went back and forth with it. She saw it initially, but it was an 8-year-old male-neutered Chihuahua that came in, and the owners didn't really know what it was. It was just bleeding, I think was the main concern. So this dog, the rectum had prolapsed at least 2 inches, so for a dog that size, that's a lot. And there was some abnormal tissue there. So Dr. Pulse collected that, sent it out for histopath to try to get a diagnosis. So this can happen for a lot of reasons, but usually secondary to straining. So we were trying to figure out, why the dog was straining to begin with. Ended up coming back as ulcerative colitis, basically. But to treat the dog, she, cleaned the tissue as best she could, used some lubricant, replaced it back into the normal position, and then this was kind of cool. And when I saw the dog, I got to do it as well, but we put a purse string in to keep it, but you have to leave it open enough so the dog can still defecate. So for this size dog, we used a 1 to 3 ml syringe, and then you put the purse string, basically suture around the rectum, tighten it up, enough to keep that tissue in there, but allow the dog to still defecate. And so for bigger dogs, you may adjust the syringe size, but the dog did well. It was interesting because this worked well short term, but the owners would go outside with the dog and watch it defecate. And if it was straining too much, they picked the dog up to try to stop that behavior. And so that was kind of a cool tip. So, that went well. The purse string stayed in usually about 4 to 7 days. I think it was about day 5 we took it out. Also did stool softeners and a low residue diet. And then the histopath, when we got those results back, it took probably about 5 days. So we started a steroid, hypoallergenic diet, kept going with the lactulose, and reprolapse, unfortunately, and the owners are very cost conscious. So that was the bummer because every time you have to sedate the dog and it's a whole ordeal. And that's when I saw the dog. So put another purse string in, kind of redid everything, kept the medications going. I took it out about day 7. Dog did well for about 10 days. So it went longer the second time. And then it reprolapsed again. So that's when they had to make a decision that, either the underlying cause wasn't being treated long enough or we needed to do something different. It was a weekend, so they ended up going to the ER and making a decision. But it was interesting. It was kind of cool to see how you manage that. It was the first time I had seen that. So, yeah.
Yeah. Interesting.
It's a bummer when it flops back out.
Yeah.
Just hanging all out there.
Yeah. Because otherwise it's like they have to go and get, part of the rectum taken out, right? Like,
I think they would do a pull through, maybe.
Very good. I was reading about the colopexy, which I've never seen done, but they tack it.
We did that, remember?
Oh, yeah, we did do that.
Yeah.
Tack it to the side to keep it in place. So that could have been an option maybe if it kept happening, but I don't think they were willing to go that far.
Didn't you then colonic torsion?
Yeah, that was the colonic torsion, and then we tacked it to the side.
Yeah, I remember that.
Yeah.
Yeah. Fascinating.
Very, very interesting. Thankfully, we don't see those very often.
Not at all.
Yeah.
Yep.
Good case.
Good case. Okay. Well, mine's quick, so I'll go next. It's just I think he's a 10-year-old lab mix. He presented for eye redness and discharge. So just started the eye exam, and unfortunately there was this abnormal structure within the anterior chamber of the eye. So I guess that's kind of hard to explain what an anterior chamber is. So just the front portion, I guess. And it was this just discolored, lobulated, irregular growth. And it was distorting the iris too. So it wasn't normal structure at all. And I checked his pressures, and thankfully they were high normal. And so that's the other thing I was worried about is that causing some secondary glaucoma, which is increased pressures in the eye. He wasn't squinty. He wasn't painful. And the rest of the eyeball itself was actually relatively quiet. So unfortunately, seeing how it's really messed up the iris and everything, the biggest concern was a growth or a mass. And so it was a Friday. We kept him comfortable through the weekend. He wasn't pawing at it or anything, and then referred him to ophthalmologist for Monday. We were able to get him in quickly. She shared the same concerns of it's a mass. And with that location and the degree of which it was distorting everything, her first recommendation was enucleation. And then, so removing the eyeball, and then they would test that mass for diagnosis. She had mentioned in her paperwork, the ophthalmologist did, about other ways you can sample the mass, but she said due to how just significant the change was, she's like, it's probably better. It's probably, unfortunately, a malignant mass. We're going to need to remove it anyway. So, that was the last kind of paperwork update I got, and it sounded like the owner was interested in removing the eye. So I'm not sure if that's been done yet. But yeah, hopefully, once the removal of the eyeball happens, it's, done and stuff, no further treatment. But thankfully dogs do really well with one eye or no eyes. They adapt really well.
Yeah.
I know it's a big extreme for owners a lot of times, but they do okay. So we'll see what it comes back as.
Very interesting.
Mm-hmm.
Yeah, dogs do exceptionally well being blind.
Mm-hmm.
Yeah. Especially the slow. I think they struggle the most if it's like acute blindness, onset blindness, but the ones that happen over time, they map out everything. They're so accommodating.
Yeah.
It's amazing.
Just don't change your house around.
Right? Yeah, don't move.
Keep it the same.
But I feel like, in comparison to humans, their senses are, shifted. Like they rely on sight, but the amount that they can rely on touch and smell and hearing is far more significant than when we can. So,
yeah, very cool.
Yep.
Okay, my case is actually a case that Dudley gave me. Is the how old was he?
He's 3.
3-year-old golden doodle, right?
Yep.
Golden doodle that presented for the owner knew this happened, right?
Yes.
So he presented for chewing out the bottom of his owner's Under Armour underwear. And so this dog has had previous obstructions and have had surgery before. And so we were concerned, as well as the owner, that there were adhesions and I think some things like that historically with the patient. So since the owners knew that this had just happened, then the decision was, do we go fetch it out or do we let him go and see how he can do? And originally I think they thought, well, we'll just see how he does. But then they decided to go ahead and pursue trying to get the underwear or the foreign material out of the dog. So we ended up doing endoscopy to try and get the foreign material out, or using the least invasive method. So we ran the scope down there, and there you could see the underwear sitting in the stomach. So we pulled out, and it was in 3 different pieces. And we pulled out all 3 pieces and laid them out, and it fit right into the butt that was chewed out. So nice. It was really cool. It was fun. That was on Fun Friday, we called it. And we took all those pieces out, got rid of it, and the dog went home that day. Didn't have to have surgery. Didn't have
it's perfect.
Anything. Yeah. He didn't know any better. Yeah. He got to eat his underwear and not have anything bad happen.
Yeah. So, thankfully. Not a whole nother surgery to recover
exactly.
from. Recovery is pretty simple. So,
did you see hard-boiled eggs in there?
Oh yeah, there was
he
lots
did
of
eat
eggs
breakfast that morning, and so
there were so many eggs, so many eggs. So, but yeah, it came out perfect. It was
good.
Yeah, it was really cool.
It's good you could grip it. enough to.
Yeah. We have
Sometimes you
some
can,
better.
sometimes you can't.
Yes. We have it being material, and because it was like in a string, I thought we wouldn't have trouble like getting it back out through and luckily it was in 3 pieces. So it wasn't as big of a piece, but wasn't in 20 pieces.
Yeah.
Where it would have taken you eternity to get it out, you know? So it was great.
Nice.
Mine, I'm only bringing this up because it has some cool treatment, and we're actually finally getting maybe somewhere. So older shepherd, probably 10 or 11-year-old shepherd, has for, oh gosh, I don't know how many years now. It started off as a king
Tell me you're
patient.
not talking about Tyra Swanson.
Maybe I'm talking about dogs similar. No, yes.
It is, right?
So, yeah,
Oh
so
my
she's
gosh.
had chronic skin issues.
Yes.
Namely around her vulva, her
Yes.
lady parts down there. So she gets really ulcerated, very painful. She's seen a dermatologist before for it, and it just never has had resolution.
Yeah.
And so, you know, we've done things like steroids, antibiotics, topical therapy. I, as of, recent, had cultured her, and she came back with a probably the most resistant infection I've ever seen. There were no antibiotics that it was sensitive to, which is really frustrating. It's not uncommon. I mean, we're seeing more and more antibiotic resistance, but it sucks for her. I don't have an oral option to give her to try to resolve this and make her comfortable. So we decided that we were going to kind of take a multi-step approach. So we put her back on steroids to kind of cool down the inflammation, itching, pain. We added in some topical therapy. We're doing things like bleach sprays and some other kind of non-antibiotic type antimicrobial treatments. But then I added fovea into her.
Aha. Yes.
Yeah.
Nice.
So I was curious to see how it might do for her. So for listeners and everything. So fovea is a newer technology to all of us. It's a photolight therapy. So its goal is it provides antimicrobial relief. It penetrates below the epidermis to provide inflammation relief. And so we don't have to worry about the resistance issue, and we may actually get some tissue healing from it too. I've been using it a lot. I'm probably the doctor that likes it the most, but I thought, let's try it in this application. And so I saw her back for a recheck, and it was probably the best she's looked in a very long time. She still has infection present on cytology. I'm not anticipating this is ever something that we will be able to prevent, cure, or otherwise, but at least she's comfortable. That, I think, is the goal, is to help her quality of life. We're going to try to take her off her steroids now because it's kind of affecting her behavior, and then keep her on topicals long term. But poor little girl, she was so ulcerated to the point that tissue's being eaten away. That's how bad it's gotten. And we've now kind of curbed that process. So I was happy with that. But yeah, I've used fovea in, surgical incisions to help healing. I've used it for acral lick granulomas now. Plenty of dermatitis, my pododermatitis kiddos. Shout out to Bailey's feet that seem to love it.
I had Pulse use it on the dog that had the nail.
Yep.
And it was one fovea treatment, and it settled down. Like, it looked as if it had 5 to 7 days had gone by.
Oh, wow.
Like from, you know what I mean? But it was only 48 hours. She was coming back for the second treatment, or he was coming back for the second treatment. And it went from looking like a mass effect on the toe to normal, like the nail being ripped off like normally, and then how it would respond and whatnot. I mean, like, I'm as big of a fan. I'm like sold on it. I think it is not for every single case, but
no, it's not.
Some of these where you're like,
be-all.
man, I'm just really struggling. Like
It helps push it. I feel like it helps push
them over the
bridge.
edge. Yeah.
It's not a sole carrier of things. You're still going to need antibiotics or topical therapy or other adjunct traditional medicines.
And I think for the lick granulomas, I think that's
lick granuloma
is really something
well.
that we should be using on every single one of them.
Although one of the dogs we were having success with it, we kind of let up on it a little bit, and of course he went right back
up
to it. So that's the only frustrating part. Is it's not a preventative, but maybe helps get over that initial hurdle of really challenging cases. So,
yeah, very cool.
Yeah.
And it's non-invasive. The dog just needs to stay still for 2 minutes, right?
Yeah.
So
super easy to use. Okay, there was an advertisement for fovea.
I didn't mean it, but I just
no, but it is, yeah.
I mean, it's great.
Especially because you're looking for anything that can optimize their your treatment success,
right?
And so it's I think try it. If you haven't tried it, try it.
Okay, listener question. Here we go. I know this is very personal, but what is the average salary for each veterinarian at your clinic? Aspiring vet, very curious about everything in the field right now. At Vin. Oh gosh.
Incognolia?
Incognoli?
Incognoli?
Sorry, Vin. Good question. Fair.
Yeah, fair question. I mean, I think some of this depends upon what area of the country you're in,
Yeah.
what type of practice you're practicing. So, I think it's small animal, large animal, exotics, mixed practice,
specialty. So many different things.
mobile vet. I mean, like there could be so many different
Yeah.
aspects, whether you're a business owner or an employee. I think that's also a factor. But I think we could probably definitely speak to how veterinarians are paid.
Well, so as to add on to that, my suggestion for a listener, anyone that's interested in figuring like that out, because we can only speak to what a small animal vet is, right?
Right.
The AVMA, who's one of our overarching organizations, if you literally type in AVMA salary calculator, they'll come up with a map. You plug in your state, you plug in what year you graduate, you plug in what type of practice you're interested in. Do you have a specialty?
That's a great resource. Yeah.
And it literally gives you a range for that like specific state, which cost of living will dramatically affect that. What someone makes in Indiana is probably not going to be the same as what someone makes in California. So, that's at least a good jumping off point to kind of know where things average out.
And I think it's really important that you're asking that that she's asking that because the debt to income ratio when you graduate, is really substantial. So you really want to know what you're getting into.
You may have a love of horses, but dear
God,
they don't make a whole
last.
lot. And
I think I think it's 5 years right now. I think that's what the average time
they stay in. They can tolerate
in the equine industry is 5 years.
It's a
And
hard.
a lot of it is because the pay. Like, I think in general, I think that I don't know if we get compared to like the salary of human doctors, but we definitely aren't anywhere close to that. So I think that's another thing to consider. Like, it's definitely not the same type of payout as it would be with medical field, human medical field. I mean, I don't know if it's a misconception. I don't know. I know that we get a lot of bad reps about how we just do it for money when ironically we don't get paid that like a human doctor or anything. But I think there's also things to consider, like starting off salary versus what's your goal to work up to? Is it to be a business owner? And then of course you have your pro sal. So you have your space.
We'll go
salary.
backwards and tell them about how veterinarians are paid in general. Meaning like
the three types of structures that you can be paid on.
And like you're a producer.
Right. Yeah.
So like
that's kind of,
I think maybe like a lot of people don't even know that. Like that your revenue, your pay is based upon you producing.
Yeah.
So basically, you can be salaried. There are certainly vets that do that. You can be, it's considered pro sal, or you can be purely production pay. But to your point, like that's where it's hard to like nail down exactly. That's why they give such big ranges, because it's what you put into it. The more hours I work, the more you earn. And so, you kind of have to balance that too. The more appointments I can see in a short amount of time frame, that also affects it. So the harder you work, the more you'd end up making. It could be limitless. I was seeing some veterinarians pulling some really large figures, but they're working well over 60 hours a week and grinding all day of trying to see as many patients as physically possible to make what they are. Yeah.
I think it's, I kind of remember from school, I don't know if you can speak more to it, but they also educate you in school because they get feedback from alumni. And so then that taking into account of where just inflation is, cost of living and everything, I think they like would give recommendations on where you should be looking, right? Or like a basic
I
recommendation.
think it just reached 100K maybe as like an average, but that's probably across the board. I don't know if that's just Indiana.
Sure.
But I don't think any one of us went into this job for the money. So it is a passion job. I mean, as for me, I always wanted to do this. And so you want to make a living to support yourself, but it is different than the other medical fields. So you do have to weigh, the debt, like you were talking about, and where you want to live and how you want to live. And I'm the youngest, so my first year out, I was just salary, and I know that's something that we do here. So you don't have that added pressure or that added component of needing to see, more patients. It's more about your first year out of school, just learning the most you can and doing the best medicine you can. And I think that was super helpful. And then I wanted to go to ProCell starting year 2, just to kind of it doesn't really change the way we practice medicine. I don't feel like, we're still giving all the options to owners no matter what, and giving the best recommendation, but it does, it's a little bit of an incentive to see, more patients and to be as efficient as you can. But it helps us as well as it helps people too, because they need to.
It's a win-win.
Seen. It's a win-win for everyone. So it's a nice option for me, but I think there are doctors here that do different options that works best for them. So kind of depends on the person.
Yeah.
And I think then also another thing to consider is how the practice is run that you work for. So it can be really hard to make a decent income if your average client transactions are really low because the area that you live in or the type of practice that they run, and so I think that also plays into it. So then you got to see 3 times as many clients as somebody else. You know what I mean? So, you see those struggles. Now, sometimes that's easier than the kind of medicine that we practice here, so it just really depends on the person and their personality and what motivates them. And there's a lot of factors.
I still remember, I've been out now for a little while. But going back to when I graduated, interviewing places and getting job offers, and one of the places I interviewed is not that far from here. It's a little bit a different side of town, but not that far from here. And offered me well less than what an average starting salary would be, more like what an equine vet would make. Versus here, it was like 2.5 times what they offered me at that clinic. It's amazing. We're not that far away, but to your point of how a practice is run, like their difference there, you're still seeing the same amount of appointments and seeing all this other stuff, but yeah, just kind of crazy.
Yeah.
And I think it all has to be then management-wise too.
Yeah. I think it all just comes full circle. Like here, All-Star, our core values are being accommodating, like just, I don't know, like just that thought of taking time and making people feel heard and like they matter and their they are important to us as well. And so in turn, that takes more time to get through an appointment. But that in turn, then you have that value that you're representing. And we also always say yes. So then that also comes around in turn of like, okay, well, when you have a practice run like that, you have the liberty to maybe be able to offer more or different benefits to your vets too, I think. So I think that's also, just what we're saying, how the practice is run and stuff. So the quality of medicine, the tools we have here, everything.
Are we just vaccinating animals or are we having to do full medicine workups? There's a big difference there in terms of our time and everything too.
So do research, do interviews, ask all the questions, like make sure you're comfortable with everything about your interview process and before you make the decision, because you don't know what it's going to be like until you're in it. It's just kind of how it is. So,
Absolutely.
Yep.
And that's all we have to offer, right?
Well, I guess the only thing we could then add to that is you mentioned being a business owner, and you're the only one with that perspective.
Yeah.
So what would you have to say about being a business owner and what opportunity that opens up?
I think being a business owner is just a whole nother that's a whole nother thing.
Yeah.
I think for me, I'm a person who wants to continually chase something. So when I was in practice and just practicing as a veterinarian, associate veterinarian in a practice, by year 3, I was bored. Like I not with the learning of veterinary medicine, but like, this is what I'm going to do forever. And so then I needed something to go after. So like, as part of veterinary medicine, I needed something to be chasing, you know, whether it be, you know, the number at the end of the month, or the being thought of as the best clinic in the area, or we have the best work environment, or we have that, you know, like there was always something, chasing something. And so I think that was what was missing. And so that's why then, because I was never going to own a business like a veterinary clinic. My dad asked me about it and I was like, no way. And then, you know, look at it now. So I think it just really depends on the person's personality and what they're going to do. And I think for our circumstances as a family, when our second son was born and had difficulties, then we had to decide who was going to stay home. And so then that was strictly a numbers decision. And so then I was making more money. So then I started working. Then once we did that, we were like, why aren't we owning a business? Because he has a law degree and an MBA. It's like, why aren't we doing this for ourselves? And so then that just led to that. Mm-hmm. And so it was like all those factors that played into it. So I think
it's a personal decision to own a business for sure.
Yeah, for sure. But I wouldn't change it for the world. It was great. Mm-hmm. All of it. Every single bit of it. Even the times I cried when the banker said, "You're never going to make it." And I was like, I can't make it.
You throw up the finger and say, "Watch me."
That's right. Exactly. Or my boss, my original boss, he said, I might have told you guys this. He was like, you're having an entrepreneurial brain fart. And I was like, oh no, you should never tell me I can't do something.
Mm-hmm.
So
now here we are.
And here we are.
On a podcast.
Thanks to all you guys working hard, living the dream, filling out the mission. Yep. So yeah, I think there's definitely opportunities for business ownership. I think the industry is going a lot of, like, our clinic sold, you know, to a corporation, SVP as a corporation. And I think that's a trend that's happening in veterinary medicine. I think there's good places and bad places. I think there's pros and cons. I still think there's a place for the independent owner out there. I really do. You know, I think that there's a place for that person. And there's also, you know, opportunities for people to partner with corporations and do it yourself too. So, I mean, I think there's a lot of different avenues to scratch that itch if somebody's interested.
Yeah.
In that.
Yep.
So, yeah.
Cool.
More than you wanted to know about.
Good information there.
Yeah, absolutely.
Okay, so thank you so much for tuning in to another episode of the Veterinary Roundtable. Remember to send in those questions and be sure to follow us on all social media platforms at All Star Veterinary Clinic. If you enjoyed this episode or a previous episode, leave us a review on your podcast provider of choice. We'll see you in a few weeks for the next episode of the Veterinary Roundtable.
All right, see you next time.
See ya.